Okay, so just a quick outline. First, we'll be doing introductions and explaining public relations within the Younger Chemist Committee. Then Mark Helberg will give the talk, A Day in the Life of a Medicinal Chemist. We'll have a question and answer session, a quick exit poll with some upcoming events, and then quick closing remarks. So first, as some quick reminders, please mute your microphone when you're not speaking. Make sure that you use the chat or the raise hand features so that you can ask questions during the question and answer session. And please do just put questions in the chat as you go if you have them. Make sure that you respect others' opinions and different questions. And for any technical problems, please use the chat to contact hosts, which are myself and Julian. So about the Younger Chemist Committee, or the YCC, our vision is to have younger leaders transform the world through chemistry, such as having events like this one to teach people about different areas of chemistry and ways you can get involved. Our mission is to advocate for, develop, and support rising chemists to positively impact their careers, the American Chemical Society, or ACS, and the future of chemistry. And then more specifically, the Eastern United States Younger Chemist Committee Partnership, or the EUS YCC partnership, is composed of different local YCC sections across the Eastern United States. So for example, I'm from the Eastern New York section. We've got Julian from the Virginia section. There's a Philadelphia section. There's a whole bunch, and you can see them all here on the screen. And ways you can get involved nationally is that you can attend YCC events at different ACS meetings. You can apply for a YCC sponsored award. And locally, you can join your own YCC section, or you can start one if there isn't one already. And you can attend local section meetings, get involved in governance or different activities, or come to a day in the life of blank chemist like this one. There's different benefits too to being an American Chemical Society member. Some examples are career development and networking. So there's free career consulting, a whole network of different ACS people. And there's also member groups and committees like the local section I mentioned, different technical divisions, student chapters, and international chapters. Additionally, you can attend conferences and events. So I know, for example, ACS Fall 2021 is coming up pretty soon. So there's different national meetings, regional meetings. There's a green chemistry conference and other ACS affiliated meetings. And like I mentioned, there's different career consultants that you can talk to. They hold office hours every Thursday from 12 to 1 p.m. Eastern time. You can also develop different non-technical skills by being an ACS member or participating in your local YCC section, like communication, confidence, and leadership, like I am now by presenting this to you all. And so you can learn these too. Now to move on to our speaker, Dr. Mark Helberg. He's the Executive Director of Discovery Chemistry at the Novartis Institute of Biomedical Research. He leads the Cambridge Syntech group, and he's passionate about all phases of drug discovery. Graduated from VCU, or Virginia Commonwealth University, with his PhD in medicinal chemistry after receiving his BS in chemistry from Washington College. So now I'm going to stop sharing my screen, and I'm going to let Mark Helberg take it away.
Oh, thank you all. Thanks, Georgia and Julian, for the invitation tonight. I am just really gracious, glad that they gave me the opportunity to speak to you. And I think the Younger Chemist Committee is just a great opportunity for you guys to get together and share experiences, dreams, passions, but really ask hard questions to people like me about what's going on in the world of chemistry and what's it like living in Cambridge. I really want this to be informal. I really value your time and appreciate you showing up tonight. I want to make sure that you get the most out of this. I want you to get what you want to get out of this. I have talk. I'm not going to show slides. Please feel free to throw things in the chat. And I've asked Georgia and Julian to jump in if they see some things, or course correct me if I get too long-winded, as that tends to happen. So with that said, and my gracious thanks to all of you for showing up tonight, I want to tell you how I came to this method of talking. So we have a Northeastern intern that's working with the group, and I happened to have lunch with her and a group of others, and I said, look, I'm going to do this talk, and I really am not exactly sure how to pitch it and where to go. And she goes, well, you know, I really like talks where we get the answers up front and then we can kind of think about what's going on for the rest of the talk. So with respects to Julia, I'm going to give you the pitch up front and then try to weave back through it and see if this all hangs together. So I'm working without a net. I appreciate your forbearance. So here we go. Find your passion. Find an important problem. Find where the two align with the world's needs. Find a place where you can be your authentic self, which is going to lead you to be your best self, and create an environment where others can be authentic and be their best selves. Be open-minded, be open to new opportunities, offer help, and ask for help. That's the pitch. So now it's a commercial. I work for Novartis, and I thought I'd really tell you a little bit about Novartis because it truly is an amazing place. And if I am too exuberant about it, it's because I really believe this. Our CEO, Vas Nasaraman, is prominent on LinkedIn. He really turned our culture to a really open, exploratory, curiosity-built culture, as opposed to a hierarchical culture that you would normally associate with a major pharmaceutical company. So please, at the very least, look him up on LinkedIn and read some of his blogs. It's very powerful stuff, or at least I find it very powerful. Challenged us as a group to reimagine medicine, to improve and expand people's lives. That's what we're supposed to do every day. And I think that's why the people in the group and across Novartis really work harder, because they believe in the patients. At Novartis last year, we synthesized and distributed 72 billion doses of medicine. And this treated 769 million patients. It's a real amazing thing that a company can do this. We do this with 110,000 employees located broadly across the globe. Vaz's approach and pillars that he's really built his organization on challenge us to deliver transformative innovation, build trust with society, and unleash the power. We are encouraged to be curious, be inspired and inspiring, be unbossed. We can follow up on that one, and work with integrity. These are the pillars that we really try to build a culture around, because the culture built around those pillars allows everybody to be their authentic self and really bring their best self, so that we can really address the important needs of the patients across the world. Going on with the commercial and unabashedly saying that there's a strong environmental commitment. Novartis is committed to being carbon neutral, water neutral, and plastic neutral by 2030. And if you want to talk about how we're approaching some of that in the labs, we can do that later. So we work in a number of different areas. We work in oncology, cardiovascular metabolism, neuroscience, respiratory disease, muscle and skeletal disease, allergy, inflammation transplant, and ophthalmology. And we work in a number of different modalities. I belong to GDC, which is Global Discovery Chemistry, and I'll probably use a lot of initials going through this just because it's force of habit, but we abbreviate everything. So Global Discovery Chemistry is just too much of a mouthful. So if I start saying GDC, just translate in your head MedChem. Our MedChem group at Novartis is 700 people. It's led by Corinne Bryant, incredibly talented and knowledgeable medicinal chemist at heart. Every week we have a lead optimization meeting that she leads, where we actually go into the nitty-gritty of projects, not so much a project review, but a sharing of wisdom around the project. And her powerful ability to condense problems and develop solutions is amazing. So 700 people, we're located pretty much in 3 sites. Basel site has about 450 chemists. The Cambridge site, which is Boston for most people, Boston Cambridge site, is about 220 people. And then there are two sites in California, one in Emeryville and one in La Jolla. So this is do. Let me go back in and start to weave through the topics that I talked to you about: passion, authentic self, being open, and offering help. So thank you for all of you. Thanks all of you for submitting your questions ahead of time. It's sort of let me kind of build this talk part. So passion. Why am I passionate about medicinal chemistry? I kind of had to reflect back on this, and I think it started perhaps in high school, where I really enjoyed math. I enjoyed chemistry. I enjoyed physics. And I had to ask myself, why did I do this? And I think it was the problem solving. I really enjoyed solving problems, coming up with solutions. Of course, the kind of solutions you come up with high school are solutions to problems that already have answers, but it still was fun. I took this to college. I went to Washington College, which is in Chestertown, Maryland, on the eastern shore of Maryland. It's a small liberal arts college. The advantage of that was that we had a lot of hands-on experience. The professors were working with us shoulder to shoulder in our labs, challenging us in problem sets, and really pushing us to do more than was necessary to get a simple, B+ on the test. I think that, once again, general chemistry was problem solving. It was kind of pretty close to math. Organic chemistry was just incredibly exciting, right? You learned the rules, you were able to build molecules. And once again, it was sort of the can building of molecules, but you could see that, there are possibilities to build things that nobody ever had built before. And that was exciting. And then PChem. PChem, pretty much my summary of this is you learned everything that you learned in general chemistry was a gross simplification, and that the world was a heck of a lot more complex than you really even began to imagine. So working through that, I really enjoyed organic chemistry. I enjoyed inorganic chemistry. I enjoyed making things. And somewhere along the line, I found out about medicinal chemistry. And not only could you make things in medicinal chemistry, but you were making things for a purpose. And in my mind, it was a really cool purpose, right? You're trying to address people's needs, unmet medical need. Maybe not so much at that time. Maybe I was just trying to look at, how opioids work or something like that. But that's what really interested me. So that was passion. So where do I have passion today? My passion today really comes in a different place. I work with an incredible group of talented people, and I work with people that are always interested in learning. And my passion comes now in really enabling them and empowering them to learn and to do the cool things that they've imagined in their mind that are really going to move us forward as a drug company, really move compounds to patients. So although I'm not making compounds anymore, and my most recent lab work was defrosting a freezer during rejuvenation week, I still am really active, and actually the coolest part of what I do during the day is working with a couple people doing library design on a project that I've been associated with for a number of years, and that's still a lot of fun. Open-minded. That's a different one, right? So I told you I went to Washington College, and then I was interested in opioid research, which was really just the beginning. And why opioid research? Because at that time, it was early in the age of understanding receptors and receptor binding using radioligands. That was the game, opioids. I had an opportunity when I was looking for graduate schools to go to Virginia Commonwealth, which and then MCV, in the School of Pharmacy, where Michael Rogers was working on opioid research. He was one of the leaders in this area, and I thought, wow, really cool to work with him. We went down there, interviewed, talked to him about this. Visions of mapping, building compounds to map receptors was really inspiring. By the time I got down there, he had returned to the NIH. And so I was looking for other things. During my early first years, I did a rotation through the lab, worked with a really talented chemist who was building irreversible adrenergic agonists. Really cool project, really tricky chemistry, really slick solutions. He built a set of compounds really to address this and to really probe receptors. At that time, those were kind of the best tools that we had. Unfortunately, or fortunately, he had a collaboration with a pharmaceutical company that I won't name that said they would test his compounds. He built the compounds, submitted them, but unfortunately never got the results. This led me to believe that, it's great to make compounds, but if they don't get tested, what do you have? It's cool to put compounds and powder in a bottle, but it's really cool to get the number associated with it. The medicinal chemistry is all about getting the number. So being open-minded, or maybe growing to be open-minded, I had the opportunity to work on a project that was an extension of Richard Glennon's graduate work. Glennon's known for his work in 5-HT, but this was mesoionic xanthine analogs. Mesoionic compounds are weird compounds where you have a positive and negative charge, forming a positive and negative charge in the molecule, but the positive charge is distributed over a number of atoms, as is the negative charge, which sort of makes them set up to do irreversible binding or acylation. It probably is a better way of talking about it. Another professor at VCU, James Stubbins, is very interested in platelet aggregation and irreversible platelet aggregation. Now, platelet aggregation is not the most exciting field, but what's really cool is that you could walk 2 blocks to Sanger Hall to the hematology department, get somebody there to draw your blood, spin it down, get some platelets, and actually test your compounds, in 3 hours. There you had some control over your output. I mean, it was really, really nice to work in the hematology department. By the time you got there, they had done all your work and they were able to just talk to you about, what they're seeing and what's that. It's pretty inspiring to understand, see the passions of someone that dedicated their life to hematology and oncology research. So open-mindedness. Had the ability to realize, there are gaps in some of this, and it's really neat to be aware of new opportunities and take them on. I learned a heck of a lot about biology through the graciousness of the hematology department, but also studying platelets. There's a lot of biology in these cells that have a lifetime outside of your body of a couple hours and no nucleus. Open-minded now, right? How does that translate? So a number of years ago, my path went from graduate school to a postdoc with Dale Boger when he was at the University of Kansas. And then from there to A.H. Robbins in Richmond, Virginia, which was acquired by Wyeth, and I was laid off. I had the opportunity to move to Alcon, which is a pharmaceutical company in Fort Worth, directed totally at ophthalmology. Maybe you've used some of their lens care solutions. So I had opportunity to work there. Novartis came in and purchased Alcon. I had an opportunity to apply for a job, either doing medicinal chemistry or the opportunity to start a new group in the Cambridge part of NIBR, Novartis Institutes of Biomedical Research. I chose the latter, right? I hadn't done it before, hadn't built a group before. And I thought, this is a really opportunity to do so in my career, in my time, to do something different, to take a chance, to work with new people doing new things and trying to come up with a different way of doing things. So that's the Syntech group. When I joined, or it joined me, we're a group of process chemists doing scale up on demand, separations on demand, and an open access parallel synthesis lab that was too complicated for people to use in an open access way. it's been a real trip to take that forward, and I'll talk a little bit about that later if you want to hear about it. But it's being open to new possibilities, open to saying, what can I do? How can I continue to stretch myself? Authentic. How can I be my best self? How can I be my authentic self? I went from graduate school, PhD in medicinal chemistry. I was able to get a postdoc with Dale Boger when he was at the University of Kansas. If you know Dale Boger at all, he's at Scripps. Before he was at Scripps, he was at Purdue. So this kind of ages me. And to age me more, I'll tell you that I was his first postdoc. Dale's group was intense. They were excellent synthetic chemists. They were hard workers. And two of those people took academic positions. Rob Coleman at Ohio State, he's since retired, and Jim Panic, who's at BU. I came there and, my synthetic chops weren't anywhere close to theirs. And so, kind of like, okay, what's this? They're going to find out that I can't do the, chiral synthesis that they can. But then, Dale Boger is a smart guy. He's an incredibly brilliant person. Why would he bring in a medicinal chemist to his group if he wanted someone to do synthesis? And I realized that what I was being asked to do was look at their chemistry, look at what they're doing, look at the complex natural products that they were building, and seeing whether I could interject places where we could do diversification, where you could build analogs, where you could start probing these complex natural products and see if you could change their phys-chem properties or their activity or their toxicity. When you realize that you're wanted for being who you are and for what you bring to the game, it allows you to change how you interact with people. I think this is an important lesson for me, and hopefully I've carried it on to my ability to work with the people I work with as we build a group where we all value each other's talents, skill sets, different personalities, and different perspectives. If you build a new group, you can then stamp your vision on it, but that's not very good, right? You're missing so much. When we went to build the new group, we really worked together to say, what do we want this to be and how are we going to get there? That's shared ownership. That's valuing people's opinions and also helping them be their best selves because they're creating their own new reality. Offering help, asking for help, easy one, right? Sometimes not so easy. We live in a competitive world, and sometimes it's a competitive world where if I have more, I don't want to share it with you because then you might have more than me. We're all selfish to some extent. I wish we were all altruistic. But what you learn is that pride doesn't get you very far. I worked at Alcon, where I came in and I was brought in to lead the antioxidant medchem program, which consisted of me. The antioxidant medchem program was an interesting opportunity to interact with a whole bunch of biologists to learn ocular biology and to really start to try to help them answer questions about what's going on in their systems. How do we build neuroprotection? What is neuroprotection? What is an antioxidant? Let's be frank, right? If you're a hydroxyl free radical, everything's an antioxidant. Doing this, I really had to ask for a lot of help. I had to ask them to help me understand their biology, ask them to understand what routes of administration they could tolerate, ask them to help me frame my ideas around how we could build compounds that would intercept these processes. It was a great opportunity. It was humbling, but it was awesome to sit down at 7 o'clock in the morning, have someone lumber in with a cup of coffee and just start talking about science, right? Just science. What is wound healing in a neuron? Why does it abort? Why do you are you prolonging death or are you preserving the neuron's function? These are all interesting questions to me, questions that I didn't know the answer to, but it was great to sit down with people and say, well, how do you think we could try to mess with that? Offering help, that's obvious, right? The most relevant or recent example of that is getting the group through the pandemic. It was tough here in March, it's tough everywhere. And we went from fully staffed, everybody working, to a place where people had to work from home, turning on a dime. The people that were in the lab were restricted to certain times so we could have a low density. And they're dedicated. They had timelines, compounds to make, and they were pushing hard. At Novartis, people were not forced to come in by any means. They were asked to come in if they were comfortable. Now, you can imagine the dedication of the people in the group, and this really provided a lot of conflict for them. Do I stay home or do I come in? How is this going to impact me? How's this going to impact my family? I have children. I have to worry about childcare. They don't train you in graduate school to really talk to somebody on a Zoom call and try to figure out what's going on in their world. The joy of that is you get the opportunity to meet their children and their pets and see their houses. So it is learning to read people over Zoom, that you can offer help. Just listen sometimes to the people that are there. I think that for me, the pandemic's been a real curse, right? I love being in the lab. I love working with the people. I love talking to them, but a real blessing in the sense that I get to know them personally more about their lives, more about what impacts them, and more about how I can work to enable them and empower them to do what they do. So that's the punchline. I really didn't talk much about what a medicinal chemist does or what a medicinal chemist is. Hopefully I've weaved some of this through. I mean, one of the questions that I was asked early, and once again, I appreciate that, is what's the difference between academic world and the industrial world? And it really goes back to my experiences in the Boger lab. In the Boger lab, you saw what intensity it took to work in the academic world. In MCV, I saw what a shame it was to synthesize compounds where you didn't have control over their testing or their ability to move forward or move into the clinic. And I think that for me, the difference between an academic lab and an industrial lab is that, yeah, you're driven by profit. I can't hide that, right? Novartis makes money, but you have the opportunities to work with such a broad array of people, and the collaboration is as hard to establish as it is to turn left down the hall versus turning right down the hall. We have incredibly brilliant people that do really amazing research. In the academic world, we benefit in the academic world, as the folks in the industry benefit from incredibly creative people addressing incredibly important problems that value their independence, that value their creativity, and that value, I think, most of all, working with graduate students, postdocs, and collaborators to really shape the future of the world that we know as chemistry. Their differences, yeah, pay, difficulty in getting funding. I mean, we see some of the same things here. We don't have the freedom to work on any project we choose. The hardest thing, coming to one of the challenges, having to stop a project when you know you're close, but the company's lost interest. They have to make those hard decisions. We have to make those hard decisions. It's for us, if we're really doing our job, to make the hard decisions for the company by creating compounds that really address the key problems and get to answers quickly so we can work on additional things. I've really talked for almost 30 minutes here. I really appreciate this and look forward to answering your questions. Please feel free to jump in, or I can take on some of the